Check your weapons at the door. It's the Medicare for the Lazy Man podcast, the great white whale of Medicare podcasts. He never mastered the boot scootin' boogie. It's Medicare expert Doug Jones.
Hello, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. I am Doug Jones, your Medicare expert. I'll be here all day, so be sure and tip your waitress, and don't forget to try the expensive cocktails that we have on tap for you. We're here to help you feel really, really good and comfortable and happy about Medicare. You may have an encounter with Medicare on your calendar at some point, and if you do, there are a few things, not many, just a few things that you should do that may differ from advice you're going to get from a lot of other Medicare experts. And I'm telling you right now, don't listen to those people because they don't have your best interests in heart like I do. I want your Medicare encounter to be productive and full of the freedom and joy that most Americans have available to them all the time. Don't accept Medicare coverage that has limitations and is going to maybe restrict you and your doctor from making choices that are really in your best interest. There are Medicare companies, Medicare insurance plans out there who will drop the hammer if they think that your doctor wants to spend too much money on your welfare. You want to have a Medicare benefit that will be working for you and not for the bottom line of an insurance company. So how might I steer you in the proper direction? Well, I would suggest that you go to Amazon.com and purchase my newest book, Medicare for the Lazy Man 2026. You type that into the search window, Medicare for the Lazy Man 2026, and you'll be presented with several choices. You may buy the paperback version of that book for $11. You can get the Kindle version for $5. You can get the Audible version and listen to it for a little over $6. And if you want to give a gift to somebody, you could do worse than to purchase the hardcover version for $25 and send that to the person on your gift list. The whole point of the book is to introduce you to Medicare, to explain how it got to be where it is, and to explain how you can avoid difficulty by making just a few simple choices. Not many choices. There are just a few choices that will if made the correct way, will enhance your enjoyment and your benefit in the Medicare program. Now, I said that was my newest book. In reality, the very newest book I've written is a very short one. It's almost like a pamphlet. It's called Medicare Enrollment Guide. You will be able to purchase this on Amazon for $5 paperback, $3 Kindle, or you can go to the website, MedicareForTheLazyMan.com. That's the site that Randy created for me. And all you have to do is scroll down just a little ways. You'll see Medicare Enrollment Guide. Click here for your free download, and that book will be yours free of charge. I don't want you even to have to leave your signature or your email address on a list, because the point of this book is to allow everybody to figure out the best way to enroll in Medicare. That book is yours for the taking. And you can also share with your friends if you like. There's no copyright enforcement on this book unless somebody tries to copy it and sell it for a lot of money. I want this book to get out there for all Americans. Once again, that is Medicare Enrollment Guide. And it's almost like a pamphlet. It's a very, very short paperback book. It's available in Kindle. It's available in Audible. You've got to go to Amazon to buy the Audible version, but you will be rewarded with the dulcet tones of almost a professional narrator reading that book for you. And finally, you need a drug plan. Everybody in Medicare needs a drug plan. If you've got Medicare, original Medicare with a Medicare supplement, you're going to need a freestanding drug plan. That monthly premium could be as little as $0. Most areas of the country have a plan, at least one plan that's available for no dollars per month. But how are you going to find out if that's the best plan for you? Well, the government website is the way to do that, but you have to manipulate that website. And I wrote a book that will allow you to manipulate the website in very short order. It's called Medicare Drug Plans, a simple DIY guide. Every page on the book is a screenshot of the website and what you click on and what you choose next. And here are your menu choices and blah, blah, blah. Pretty soon, you'll find yourself enrolled in the best available drug plan for you. And if that doesn't work for you, then maybe what you want to do is put yourselves in the hands of a company that has done a professional job of creating a subscription-based plan selection service that's more sophisticated than even I could come up with. They didn't bother writing a book about it. They actually go right to the source. They people like me, and they say, "Would you please send your clients our way?" So, if, ladies and gentlemen, you have a very challenging drug regimen, or if you've got a lot of drugs and you want to get the best possible value, you want to make sure that you're not overspending for your drug plan, then go to Hey Mo. And what you do is go again to MedicareForTheLazyMan.com, scroll down until you see Hey Mo. Click on that, and that link will take you right to their service. You can look it over and see if that service is for you. If it is, the link that I've just steered you towards is going to give you a small discount on their subscription. And I trust that you will get the best possible advice by going to the Hey Mo service if you have a lot of drugs or a challenging drug regimen. So, having said all of that, then I feel as though we should close the episode off and call it a day. But Randy wouldn't let me do that. He's looking very quizzically, like, "What the heck is wrong with you?" So, I guess we'll have to continue on with our typical Medicare content. But I do like the opportunity to say good morning to Randy Carson, who is enjoying our balmy early March weather. March came in like a lamb this year.
Yes, yes. And I hope, sincerely hope, that doesn't mean it's going to go out like a lion.
That would be scary. That
Yeah.
would be scary. Now, you would think we've gone by January, we've gone by February, so we would think that March is going to be very benign and continuing to be comfortable and warm. But I remember years ago, a friend of mine named Roy, and Roy's been a guest on this podcast. He fell in love with Arizona, thanks to me, and he bought a house here, not too far from you, down in Tatum Ranch. And he asked me to watch that house while he was preparing his New York house for sale. He was going to move out from New York. And I had to go over there on many March mornings or excuse me, evenings, because it was going to be so cold at night that he was worried about his hose bibs and his outdoor plumbing bursting from having been frozen. So I had to prepare to, cover those things up and make sure that they did not freeze. That happened in March. Pretty scary, huh?
That's almost impossible to believe out here.
I know. When you rely on the calendar for your well-being and the calendar
Okay.
kicks you in the teeth.
Okay. I'm telling you that is a story that I never thought I would hear. Anybody out here worrying about their hose bibs freezing?
Yeah, that's not typical, but I guess the building codes are such that, well, 99% of the time it's not going to be a problem. So well, Roy was worried about being that 1% and not being home to mitigate the damage
Yeah.
if that happened.
Yeah. Yeah. Well, this was not a freeze, a case where something froze, but our neighbors right across the cul-de-sac,
Uh-huh.
they only live here part-time. They live up in Utah the rest of the time, and they had a pipe break, and it flooded their entire house,
Yeah.
ruined everything.
You might remember Clarence, my one college friend, 9 years in
Yeah,
college, one friend I have
yeah.
from college. How did that happen? I must be a real.
So you were pretty selective.
No, I think the other people were more selective than I. But what happened was Clarence had a two-story house down in Gilbert, and a toilet supply tube just decided to let loose. And two doors down from me in this neighborhood here, that happened to a friend or a neighbor that was out of town for like most of the winter, summer, I guess. And it just taught me a valuable lesson. I now have a whole house shut off. Anytime I leave town, I turn that sucker off.
Well, I think that's a great idea. The other thing, obviously, you know me, I'm a tech geek.
Yes, I do know
The
that about you.
the other thing I have added to that formula is I also have remote water sensors that I have stationed throughout the house under various sinks and various things. And
Uh-huh.
if they sense any water, they will notify my cell phone.
That's a wonderful thing because if you're off in Omaha enjoying life in Nebraska for a while and your relatives and all that stuff, you're going to have trouble finding a way to fix that, aren't you? Long distance, and the
No,
dogs aren't.
I'm going to call you.
Oh, okay. Well, I'll be happy to contribute my efforts toward.
Hey,
Of course,
Doug, 2 o'clock in the morning. Hey, Doug,
yeah,
my sink's leaking. Could you go help me out here?
yeah. It's which sink is that, Randy and Ed?
And then your
Well,
answer to that would be, who's this?
I don't know any Randy. Click. I do know Medicare though. Maybe we should get down to work here. Do you think that would be a good idea? Most
Let's make some money. We're I know traditionally we're scraping it in by the bucket load on days like
Yeah.
this, so let's do that again.
All righty. Well, let me start with the headline for our Medicare Advantage Minute, the segment of each episode where I try to convince people that Medicare Advantage is not the way you want to go when it comes to approaching Medicare for the first time. You want to go with Medicare Supplement. But here's a headline for our Medicare Advantage Minute: How Medicare Advantage Costs Taxpayers and Retirees. With private insurers set to receive $1.2 trillion in excess payments in 2036, retirees may soon face a reckoning over costs and coverage. You know something? This article also uses the term retirees rather than seniors. I
Oh,
think
for at
I've
least they don't
changed.
use silver sneakers.
Well, they don't use anything silver so far, but I think I have changed the face of nomenclature in America. I think business schools are going, hey, that Jones guy doesn't like the word senior. Let's change. What else can we find that would be equivalent to old people without being insulting? And I think the word retiree is moving into to substitute. So anyway, retirees may soon face a reckoning over costs and coverage. Medicare Advantage, the private insurance system that supplants traditional Medicare, a lot of people don't know that. It takes Medicare away and substitutes its own insurance company, its own insurance plan. And so you can only have regular Medicare with all of its freedoms if you have a Medicare supplement to go along with it. So anyway, Medicare Advantage continues to set off alarms, triggering massive overpayments, costing taxpayers billions of dollars. The latest comes from the nonpartisan Committee for a Responsible Federal Budget. It projects a $1.2 trillion in overpayments over the next decade, based on an estimate from the Medicare Payment Advisory Commission, MedPAC. That's an independent agency that provides Congress with analysis and policy advice on the Medicare program. Medicare Advantage plans will be overpaid by roughly $76 billion just this year. If continued, we estimate that this would translate to $1.2 trillion of overpayments through the year 2035. Latest videos from Kiplinger, unlike traditional Medicare, in which providers are reimbursed for each procedure they perform, Medicare Advantage plans are paid a monthly amount per enrollee, with the size of that reimbursement adjusted based on the health of each participant. More than half of all Medicare participants are enrolled in the alternative private plans, which tend to offer individuals more benefits while relying on government subsidies. Critics say Medicare Advantage's private insurers are incentivized to find billing codes that support higher payments, regardless of whether they are supported by the participant's actual health. One method for doing this is known as upcoding, where insurance companies increase the number of diagnoses for patients to make them appear to be sicker or at higher risk. To compensate for this, the government reduces Medicare Advantage payments by 5.9%, but MedPAC estimates that Medicare Advantage plans overall cost 14% more than traditional Medicare. But evidence suggests that Medicare Advantage enrollees are generally healthier than those who use traditional Medicare, meaning that the Medicare Advantage patients' costs are lower. Medicare Advantage overpayments could drain trust fund coffers. The committee also estimates that $520 billion in overpayments will come from the Medicare Hospital Insurance Trust Fund. Absent those overpayments, the trust fund would be solvent for the next decade and beyond. Instead, the trust fund is projected to run out of reserves in 2032. Additionally, Medicare Advantage overpayments also increase the base premiums by $230 billion over a decade. Potential fixes for Medicare Advantage upcoding. What are the prospects for fixing this situation? That's anybody's guess. On the positive side are several bipartisan proposals, including the No Upcode Act, introduced by a couple of Republican senators. The act would eliminate the use of health risk assessments to boost coding intensity and utilize 2 years of data to more accurately depict the health status of Medicare Advantage patients. This could save $150 billion or more. And we go on with possible solutions to this problem. Frankly, Randy and I think the best solution is that Medicare participants should give serious consideration to never enrolling in Medicare Advantage plans and always using the alternative, which is Medicare plus a Medicare supplement. Because in a free market, everybody is free to choose or not to choose. So the government has efforts on one hand to stop the outflow of money being paid to these plans. And we, on the other hand, on the market side, can certainly use our influence to stop the individuals who are most interested in purchasing the finest insurance coverage from purchasing Medicare Advantage plans when the finest coverage is, in fact, Medicare with a Medicare supplement. I'm looking at my timer, Randy, and I believe it has finally given up the ghost. So once again, I'm going to have to rely on you to give me the high sign when we're pretty close to running out of quarters for today.
I will let you know when the sand's in the hourglass. Oh, what was that show? What was that show?
Some kind of soap opera.
It was the sand. Yeah, it was something about the sands of the hourglass. Yeah, I will let you know when the sands of the hourglass have run out.
Please do. And if you could put that hourglass where I could see it, then you don't even have to let me know. I'll just.
I was going to mention one thing.
What's that?
And I'm not the expert, but I think I would like you to say to your folks on the podcast today, stay away from the Medicare Advantage lottery. You're always going to lose.
That's an excellent way to picture it. It's a lottery, a life lottery that you can rarely ever win, because the only way you can win is if you just keel over. And who in the world is going to predict that accurately?
Yeah, exactly. And that's the reason that the Las Vegas makes all the money. It's because they are controlling the odds.
Yep, that's right. And they just, a little small tweak in the odds means that they walk away with big piles of cash.
Well, I stated my piece, and I'm going to turn it back over to you so we can get back to the real stuff.
Well, I want to read chapter 2 of my newest, shortest book, Medicare Enrollment Guide. This book is designed to help people who need enrollment instruction, and they don't need anything else because the book doesn't provide anything else. It only provides instructions as to how to enroll in Medicare. The trade-off for that is it's very short and very inexpensive. It can be yours for free, and I'll tell you how that can happen at the end of reading chapter 2 here. Apply for Medicare, parts A and B. After reading chapter 1, you have probably given some serious thought as to which month you intend for Medicare insurance to begin. In case you're not sure what you're signing up for, here is the official scoop. Part A, called hospital insurance, covers medical expenses incurred for inpatient hospitalization, skilled nursing and rehabilitation facilities, and hospice care. Part A is free of charge for almost all Medicare participants. Part B, called medical insurance. This covers the cost of treatment by doctors, testing and diagnostics, medical equipment, supplies, and preventive care. Part B has a monthly premium to be paid by the insured. Plan to contact the Social Security Administration between 2 and 3 months before your desired effective date in order to give the bureaucrats enough time to work their magic on your application. Do not delay the start of this critical step. There is no consistency in how efficient the various Social Security Administration offices and clerks are when processing your paperwork, so you will certainly avoid frustration by acting promptly. My recommendation is to start the Medicare application process online by going to www.ssa.gov/Medicare and then follow the instructions. You may also either visit your local Social Security office or call your local office for their recommendations, or call the National Social Security Administration telephone number 800-633-4227. However, using the online application method is likely to produce the best results. If you expect to continue working for your large company and stay enrolled in their creditable health insurance plan, understand that you do not need to do anything about Medicare. Applying for cost-free Part A is an option if you do not have an HSA. This will equip you with a partial Medicare card, some extra hospitalization protection, and a Medicare identifier of your very own. That's a Medicare number. However, it would be a mistake to enroll in Part B if you're not planning to leave your current insurance. The reason is that you will eventually need a Medicare supplement plan for complete protection. If you carelessly apply for Part B while you still have large group benefits, you may be giving up the critical one-time only guarantee that is only available for the first 6 months that one has Part B of Medicare. This guarantee ensures that you may enroll in any available Medicare supplement without regard to your health history. When you have worked past age 65 and are beginning to plan your application for Part B, there are 2 additional forms that may be requested by your Social Security Administration processor. Here are the forms. CMS-40B, that's the application for Part B of Medicare, and CMS-L564. The name of that form is Request for Employment Information. Each of these forms may be downloaded from the internet, and each includes voluminous instructions. Now, CMS L564 should be completed and signed by an official at the company that provides the health insurance that you've had since turning 65. This form is the attestation that you were covered by creditable insurance and shall not be subject to a late enrollment penalty. If company officials refuse to cooperate with your request for a completed L564, you can still prove your participation with other documents like pay stubs and insurance ID cards. When your portion of the process has been finished, the Social Security Administration will inform you that it will be necessary for you to wait while they finish their part of the application process. You will be notified when your Medicare application has been approved and the start dates of your coverage will be confirmed. As part of the application process, you will have been asked to establish an online password-protected account into which the Social Security Administration will drop documents to communicate with you. Keep a close eye on the contents of your My Social Security account so that you do not overlook any of the documents that the government deposits there. One day, sooner or later, the official document confirming your Medicare approval will appear in your account without any warning or advance notice. More about your benefit verification letter in Chapter 3. So that is Chapter 2 of Medicare Enrollment Guide. Wow. I feel as though we've done a whole episode's worth of work in just a short period of time.
Well, and in most cases, that would be true.
but apparently not in this case. So let's forge ahead.
No, we have about, I'm teasing a little bit, but we have about an hour and a half left to go.
Oh boy, I better lubricate my vocal cords again. And I'll pick a little lengthier article than I had in mind. CMS, that's the government, Centers for Medicare and Medicaid Services. It's called CMS. The government freezes enrollment in ELEVENCE Medicare Advantage and Part D plans. Wow. This is the insurance company that used to be called Anthem, and they are changing their name to ELEVENCE, but they are not flying under the radar, ladies and gentlemen. The government has announced, I've got two articles here, they have threatened ELEVENCE to disallow them from marketing their Part D and their Medicare Advantage plans, their drug plans and Advantage plans, starting at the end of March, if they don't toe the line with certain reports and information that they apparently have been remiss on. Now, I'm not going to sit here and read a bunch of the fine print about these violations that are alleged to have occurred, but I will say that I'm pleased to see the government stepping up to the plate when it comes to forcing some of these Medicare Advantage plans and these drug plans to act more responsibly. I don't know if the particulars are fair to the insurance company, but I know they've been getting away with murder over at least the time that I've been involved in Medicare. And I'm glad to see somebody is making them pay attention to the regulations that they're supposed to be adhering to. Whether those regulations are reasonable or not is quite another story, and I'm not prepared to pontificate on that right now. But Anthem, or ELEVENCE, as it's going to be known, has been at least given a cease and desist order that by the end of this month, they're not going to be able to sell drug plans and Medicare Advantage plans if they don't straighten up and fly right. So here's a sad story, because I remember fondly when I was a kid, all the doctors around us were, in independent practice, and they were all prosperous. And that was the way I thought life was going to continue for the rest of time. But here's an article, the headline of which is "The Rapid Decline of Independent Physicians in 10 Key Stats." Not states, but stats. So let's see if we can find 10 statistics in this article. Independent physician practices are rapidly disappearing as hospitals and corporate entities accelerate acquisitions across the country. Physicians' abandonment of independent practices will continue and probably accelerate over the next decade, despite its undesirable impact on autonomy. This is mainly due to unsustainable increased demand on physicians regarding productivity, efficiency, and fiscal responsibility with fewer resources, which is driven by the continuous decline in payment and the increase in cost of overhead and supply chain. This disparity has a net negative impact on the work-life balance for physicians, a group that historically has always been asked to stretch their limits to generate an adequate margin to sustain their business. So let me read the individual notes they have. Number one, ownership and employment are consolidating fast. Between 2019 and 2023, the share of independent physician practices owned by hospitals and health systems or other corporate entities jumped from 39% to 59%. Now, 59% of the independent physician practices are owned by hospitals, health systems, or other corporate entities. Over the same period, physician employment by these entities rose from 62% to 78%. Oh boy. Number two, rural practices are disappearing much faster than urban practices. Number three, larger practices are prime acquisition targets. Number four, merger enforcement remains relatively weak. Federal scrutiny of hospital transactions remains below average. 51% of hospital deals and 26% of ASC, I don't know what ASC is, received federal clearance, well above the 13% clearance rate across all industries. Rural independent physicians are vanishing. And once again, that's what I grew up with in Wayne, Illinois. Couldn't get much more rural than that. And the doctors we had were gentlemen farmers, and they were people that were looked up to, and apparently they're now disappearing. Number six, nearly 9,500 rural physicians left independence. Number seven, private practice is no longer the norm. In 2024, just 42% of physicians work in private practice, down from 60% in 2012. Nearly half were employed by or affiliated with hospitals. Okay, here's number 8. Corporate and private equity influence continues to grow. Number 9, regional declines are tied to hospital acquisitions. And number 10, certain specialties are being absorbed faster than others. Independent practices declined most sharply in anesthesiology, internal medicine, neurology, gastroenterology, family practice, obstetrics and gynecology, cardiology, oncology, and general surgery. So we're seeing obviously a decline in independent physician practices. I wonder when that's going to happen for dentists. I know there's some growth in chain dentistry offices, and consolidation of overhead costs and all that stuff probably has a factor in that. But the independent practice of dentistry, I fully support, and I'm hoping that that does not go away. Medicare Supplement Plan G average premiums continue to spike into the year 2026. As noted in previous articles, Plan G average premiums have increased markedly in the past 2.5 years, and that trend appears to be continuing into 2026. The chart below shows average Plan G premium rates. Oop, the chart below is gone. You'll have to take my word for it. The chart used to show that Plan G premium rates year by year for the 5 most competitive carriers are spiking sharply. The Plan G average premiums for the 5 most competitive carriers were flat, around $1,400 a year for 2020 through early 2024, but have increased substantially in the past 24 months and now average something on the order of $1,850. So divide that by 24 and you'll find the average premium for a Plan G rate, and that's across the country. If you go to New York or if you go to Southern Florida, you're going to find that the average Plan G rate is definitely much higher than that. So what do you think, Randy? Are we doing okay time-wise?
We're out.
Well, then I'm going to say get a few more quarters ready, because I'm going to skip some of the content I had and go straight to one of the things I'd love to do, and that would be to ask you questions that really have no answers.
Okay.
Okay. This one, I knew we had to address it because it's a broad-reaching subject that has the welfare of every American in its sights. What are the 10 best states and the 10 worst states for women in 2026? In other words, if you're a woman, there are 10 states that would be best for you and 10 states that
How
would
am I supposed to make a guess at this?
Okay, if you can't pretend to be a woman just for a couple of minutes here, then you're not the wide-ranging bon vivant that I thought you were.
Okay, so I'm going to make a wild guess at what one of the best states would be, and I'm going to say Nebraska.
Well, let me find Nebraska if it exists on this, and no, it does not. Nebraska doesn't appear in either the best or the worst, so that's probably good for Nebraskans.
Okay, well, let me make another guess then.
Okay. You will have guessed this on many other quizzes, so let's see if you can dredge it up out of your brain for this.
Massachusetts.
Yep, that's it. Numero uno, Massachusetts, the best state in the world for women. Now, we get a lot of flack from Stalker Susie every time we bring up Massachusetts in a negative light, but I will say that this supports everything she says. This is one of your typical wallet hub things. It says the personal finance website. Let's see. The best and worst was compiled by comparing the 50 states and Washington, D.C. across 25 key metrics. Let's see. We multiply 50 by 25 key metrics by each metric was graded on a 100-point scale and grouped into 2 categories. So how many elements is that? We've multiplied.
Holy banana. That's like thousands of possibilities.
You've got to be a specialist in math field to be able to even do the computation.
You know who did this, right? Somebody with an AI tool.
Well, there you go. They probably just sat back with their feet up and watched the AI tool and crunch the numbers for them. So 2 major categories, women's healthcare and safety, and women's economic and social well-being. It seems like those would be very subjective categories, wouldn't you think?
I'm pretty sure they are,
All
but
right.
maybe
Well,
AI was good. I don't know.
let's see what AI has to say. The top 10 places, the top 10 states for women. And I guess you throw in Washington, D.C. So we got Massachusetts right on top of that list. Washington, D.C., number two. I would have to say that Washington, D.C. might not have been a very good place for women from the safety aspect until recently, where I think recent events have changed that a little bit. Maine, number
Maine,
three. Yep, I can't explain it. I only report it.
every week doesn't you don't have to be a woman or a man. Every week somebody freezes to death up there trying to change their flat tire.
Well, let's then go to the fourth one, which is a much more happy and benign place. Minnesota.
Oh my gosh.
Nobody freezes in Minnesota, do they?
Oh, well, I don't know that I agree with that because they actually put them in railroad cars until the temperature is above freezing.
Yeah, there you go. Okay, the final in the top 10 are Maryland, Vermont, Connecticut. So far, everything is miserably cold. Finally, Hawaii, and then New York and Oregon are the last two in the top 10 best states for women. How about the worst, most horrible states where women should be packing their suitcases and getting the heck out right now?
Louisiana.
Let me see. Surprisingly enough, Louisiana shows up as the worst of all possible places for women to be.
Does it really?
It's right on the bottom of the list. And
Oh
guess
my
what?
God.
The state
You
right
mean
above
I
it,
actually got one right?
you not only got that one right, you hit it right. It's a bullseye. And the state right above it, the second worst, horrible, most horrible state for women in the whole wide world is Oklahoma, my beloved Oklahoma.
What's the matter with Oklahoma?
I don't think anything is, but somehow Wallet Hub decided that, with all those parameters that they put forth. So Arkansas, because Oklahoma and Arkansas are tied together very closely. Texas, once again. Alabama, Wyoming, South Carolina, West Virginia, Mississippi, and Idaho. What are we seeing there? I think we're seeing red states
Oh gosh,
exclusively.
there's a lot of commonality there. I don't think it takes too much AI to figure that out.
Now, AI has a definitely leftist tilt on that list of places that are best and worst for women. So enough is enough. Let us release the audience to go about their business for the day, shall we?
Okay, well, grab your pencil, folks. Write this email address down, dbj@mlmmailbag.com. You can reach out to talk to Doug, so to speak, ask him questions, make a comment. That would be the email address to use, dbj@mlmmailbag.com. Doug is and always was licensed nationwide to help you with your Medicare supplement planning. MedicareForTheLazyMan.com. That's the website that's got it all happening. And drop a couple reviews for us as you're wandering around the internet. We still want to stay ahead of the travelogue people. Thank you. Thank you all, every one of you, for joining us today. You could have been anywhere else, but you weren't. You were with us listening to Medicare for the Lazy Man podcast, and you've spent, if you didn't check, about 32 and a half minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma. Not now. He's living up in the high ground behind Cave Creek, Arizona, in the high rent district, otherwise known as the Nosebleed Mountains, home of the Nosebleed Indians. And I'm going to put him in. This time I really got to, I got to take him down below 6,000, 40,
Please.
50, 5,200 feet.
I can live with that. Thank you. Thank you, Randy. And thanks you, ladies and gentlemen, for joining us today because we always enjoy having you with us. I'm hoping that you'll come back and join us for our next episode real soon. Until then, bye-bye.